We've got to be ethical. There are so many horrific things going on that have affected how our industry is viewed. Patient brokering, people charging money for urine drug tests, just insurance fraud, fee splitting, breaking confidentiality. There's some horrific things going on out there in the industry, and we have got to come together. Somehow, some way, things got this bad. And there's some of us who've been talking about it for a long time, but it's time for us to unite and to come together, and we have got to regulate this industry. There have got to be things that are absolutely unacceptable. When parents go onto the web to try and find a treatment center, it is not safe. They're already lost. They will have call centers that are going to tell them that they can do anything and offer airline tickets, free health insurance, and people will not get to the best type of treatment that they need. It's absolutely unethical, and it's illegal in Florida. It ought to be illegal everywhere. If a mom's daughter had leukemia and she called a hotline and found out that she was referred to a treatment facility because the treatment facility paid the hotline the most money that day, we'd be outraged. We need that same outrage because that's happening every day with addiction. I just had a phone call just a couple of days ago. They were offering free health insurance, all kinds of, it was a patient broker. It's still happening. And our families are vulnerable and they're susceptible, and we've got to step in and protect them.
I know you have been a uniting force in our industry, getting professionals to look toward cures to this sickness, ethical sickness that's plaguing us.
I've been talking about ethics probably since the early 2000s. I watched it over years. I can tell you that I've been bullied, I've been ostracized, really been on the other end of lots of negative comments because of my ethical stance. So one of the things that I've done is I've helped form a group. It's called Unite for Ethics Now, and we have got an amazing board. We've got parent advocates, because I'll tell you what, it's the moms and dads out there that are really the movers and shakers and helping things change, helping laws change. We've got some excellent addictionologists, some CEOs from treatment centers, county commissioners, we've got some senators, we've got some attorneys.
So what are some of the things where you're taking a leadership role in our industry?
And we've got a powerful, powerful group that is motivated, and we're working. And we want to look at coming up with ethical blueprints to help consumers, to help providers, and to help professionals, so that we can begin to standardize things and to really come in and say, this is exactly what good quality care looks like. Parents need to be educated. What are the questions that you ask when you call and you're talking to a treatment center so that you can find out whether or not they're the right fit for you? What are the warning signs? We're now at a place where unfortunately things have gotten horrific, and it's gotten a lot of people's attention. So one of the things that I've done is I developed an ethics pledge. It's the Heather Hayes and Associates Ethics Pledge. And I asked people to sign it. And it's just a way of saying, I am committing to the fact that I'm not going to participate in these unethical behaviors. And it's got a standalone website that doesn't link to my website, so that you can go and look people up to see, have they signed the pledge or not.
Many months ago, I received one of those e-blasts on an email, and it was Heather Hayes, and it was the pledge. I loved that. I mean, it was just very specific about the ethics that guide our industry. And proudly, we signed that. And I think all providers should sign that.
I think all providers should sign it too. I mean, again, it's not a governing force, but it's at least one way to say, I'm committing to doing the right thing. The other thing that I've done is I've been trying to put out as many ethics articles as I can. Published one last month, published one just recently with Dr. Louise Stanger that's going to be coming out soon, because this is a topic we can't forget and we can't let go. We're also trying to work really hard with legislators to get laws passed similar to the ones that have been passed in Florida that can help protect families and help protect all of us.